We all wish that teeth would last forever, but unfortunately, they don't. And when we lose a tooth, we can either replace it with a dental implant or a 3-unit traditional bridge. A bridge involves preparation of the 2 adjacent teeth so that a bridge can be fabricated, which is then cemented onto the teeth, replacing the missing tooth. Why would we choose a dental bridge over a dental implant? Well, a dental bridge is a relatively quick way of restoring 1 or more missing teeth without the need for dental implants. This is a great option for patients who want a fixed restorative solution without the need for surgery. Who is a good candidate for a dental bridge? The best candidate is someone who has strong roots and bone support. In order to fabricate a bridge, the adjacent teeth to the missing area have to be healthy to support the future bite. A dental bridge is an excellent option for a patient who would like a missing tooth restored quickly. A dental implant can take upwards of 1 year in treatment time to complete, whereas a bridge can be completed in the span of roughly 1 month. While a bridge can still be costly compared to a removable partial denture, it is a cost-effective way to restore a missing tooth with a fixed prosthesis. Unlike a removable partial denture, a bridge stays in your mouth permanently and is cared for just like natural teeth. However, good oral hygiene is essential since the supporting abutment teeth can still develop dental caries around the crown margins. The dental bridge timeline. First, a new patient examination and consultation is required in order to determine the ideal treatment plan. Once a treatment plan has been established, the first appointment involves preparing the teeth, taking a definitive impression, and inserting a temporary bridge. The temporary bridge gives us the opportunity to make sure that you're happy with the aesthetics, the bite, and your phonetics before making the final bridge. At your next appointment, we will insert the definitive bridge. If needed, custom shading and adjustments to the restoration will also be completed at this appointment. While it can take a few days or weeks to get used to the new bridge, you will be able to eat, speak, and smile right away. Most of my patients report no significant concerns after having a bridge inserted. However, on occasion, some patients may develop some sensitivity while they are getting used to the new prostheses. This usually resolves over a few weeks as the teeth and soft tissue heal naturally. How are dental bridges made and customized for each patient? The teeth are prepared on either side of the missing tooth to create space for the restorative material of the bridge. A digital impression is made and sent to our in-house dental laboratory to start the process. A temporary bridge is made for our patient to use while the final bridge is being made. Any adjustments made to this temporary bridge will be copied into the final version to make sure the restoration is as seamless and form-fitting as possible. We use zirconia for the final restoration for its strength and aesthetics. In the laboratory, we use 3D CAD/CAM software to design the bridge in a way that is customized to your bite and smile. The design is milled and the zirconia is then sintered to create the framework of the bridge. Our technicians characterize the restoration by hand using porcelain stain to achieve the custom shade obtained at the initial preparation appointment. On the day of insertion, my team and I may add further custom shading to the bridge to ensure the best aesthetic result possible. How long does a dental bridge last? Our patients at Vivid Specialized Dentistry have bridges that last anywhere between 7 to 25 years. The key to longevity is regular hygiene and maintenance, both at home and in the office. I prefer to see patients at 3 to 4 month intervals for hygiene to ensure that plaque and calculus buildup remain minimal. This will greatly enhance the longevity of the bridge by preventing the development of dental caries, which is the #1 cause of bridge failure. The downsides of dental bridges. A dental bridge requires the shaving of adjacent teeth in order to fabricate the restoration. If the teeth require crowns, this can be a great solution. However, if the adjacent teeth are in good general health, it may be better to avoid shaving them down, as this can compromise the integrity of the tooth. In a situation like this, I would highly recommend using dental implants in order to preserve the dentition while restoring the missing tooth. If you're considering a traditional dental bridge or an implant bridge, contact our office and we'll be happy to help find the best option for your specific needs. Visit www.vividdental.ca to learn more about dental bridges, implant bridges, and so much more. My name is Dr. Arif Sumar with Vivid Specialized Dentistry here in Edmonton. Thanks for watching.